Diagnosis and treatment planning for dental implants. Edentulous patients can be either restored with fixed partial denture, dental implants, or removable partial denture or complete denture. Diagnosis involves collection of facts obtained from a comprehensive patient history, both medical and dental, patient interview, thorough clinical examination, critical evaluation of mounted cast, radiographic interpretation. The need for replacing teeth. With loss of teeth, the structural integrity of dental arch is disrupted and there is a subsequent realignment of teeth as a new state of equilibrium is achieved. The teeth adjacent to or opposing the edentulous space frequently move into the space, may drift bodily. A tilting movement is common. So, a definitive diagnosis follows careful review of all the available information. Treatment plan is nothing but the formulation of a logical sequence of treatment designed to restore the patient's dentition to good health with optimal function and appearance. The aim of the treatment plan is to provide most predictable and most cost-effective treatment that will satisfy the patient's anatomic needs and personal desires. The treatment objectives aim in correcting the existing disease, prevention of future disease, restoration of function, and improvement of appearance. The correcting of existing disease. The disease process can be arrested by identification and reduction of initiating factors, identification and improvement of resistive forces. Restorative care will replace damaged or missing tooth structure, but additional treatment is essential for controlling the disease that caused this damage. Prevention of future disease. Propose a future treatment option considering the patient's disease experience and the prevalence of the ailment in the general population. The restoration of functions requires correction of impaired functions such as mastication and speech. Improvement in appearance. Long-term dental health should not compromise in hampering the aesthetics of the patient. So, selection of the type of prosthesis depends whether it is an RPD, FPD or implant supported prosthesis. These are the factors that to be considered while selecting the type of the prosthesis. Removable partial denture. The advantages are it is indicated when no distal abutment is there, multiple missing spaces is present, bilateral edentulous space is present with more than 2 teeth that are missing, when the teeth are tipped, divergent, periodontally weak, short teeth, insufficient number of abutments, there is significant amount of ridge loss, compromised oral hygiene, advanced age, economic factors and systemic health problems. Conventional tooth supported prosthesis is indicated when there is sound abutment, short and straight edentulous span, no gross soft tissue defect and patients who are highly motivated. Resin bonded tooth supported FPDs are indicated as a conservative restorative therapy when the abutments are defect free, in single missing tooth, in younger patients with normal vertical dimensions of face. No prosthetic treatment is required for long-standing edentulous space with little or no drifting or elongation of adjacent or opposing teeth, no functional, occlusal or aesthetic impairment. The teeth adjoining an edentulous space usually moves, but they do not always move. Implant supported prosthesis is indicated when there is insufficient number or inadequate strength of abutment teeth, absence of distal abutment, requires perfect abutment alignment than conventional FPD or xerostomia. In addition, partially edentulous conditions, traditional prosthodontic treatment in FPD, even in implant prosthesis, applies the same. Advantages: fewer pontics, no destruction of sound tooth structures of adjacent abutments, more retentive units, increased stability and support, longevity of the implant prosthesis is high and minimum complications. However, limitations may be more difficult. Sometimes complications do occur. The patients cannot remove the prosthesis at night if there is a parafunctional habits. Lack of labial flange in prosthesis may affect facial aesthetics and hygiene maintenance is highly demanding. Indications for implant treatment: when there is severe morphological compromise, poor oral muscular coordination, low tolerance of mucosal tissue, parafunctional habits leading to recurrent soreness and instability of prosthesis. When there is active or hyperactive gag reflex, when the psychological inability to wear removable prosthesis exists, when there is unfavorable location and number of potential abutments, when there is single tooth loss to avoid involving adjacent teeth as abutments.